It is now my honor to welcome to the podium U.S. Member of Congress Jonathan Jackson, who represents Illinois' 1st District and serves on the House Agricultural Committee, to say a few words. Please give him a round of applause.
Happy holy season to all of those in the celebratory mood. I would like to address my remarks on eating ourselves sick. My friends, in the long chronicle of this nation, we have confronted many foes, some visible, others hidden beneath the calm surface of daily life. Today, I speak of a very subtle enemy, yet profoundly destructive, the quiet, persistent crisis of people eating themselves sick. In a land of extraordinary abundance, it is a bitter irony that so many Americans, particularly the poor, the marginalized, and the forgotten, subsist on food that undermines their very existence. We are surrounded by ultra-processed products, manufactured in laboratories and factories, engineered for profit and not for life. These foods, bright in color and hollow in nourishment, seduce the palate while weakening the body. The flood of communities with sugar, salt, chemical additives, and empty calories, fueling epidemics of obesity, hypertension, diabetes, and premature death. Yet, to cast this as a mere matter of individual choice would be to ignore the deeper structures of inequality that shape American life. For what choice exists where there is no access? What freedom is there when there is a community where a head of lettuce is harder to find than a bag of potato chips, and where the nearest supermarket lies miles away across highways and forgotten across the rural roads? In urban America, like the district I serve, in Illinois' 1st Congressional District, we see ghettos that have been formed, created by decades of segregation, redlining, and economic abandonment. Vast structures of neighborhoods remain where there is food as deserts, oasis in name only, where the only readily available substance is processed, packaged, and poisoned in slow measure. And in the rural part of my district, we find where the fields themselves feed the nation, too many communities endure a similar scarcity, where poverty, dwindling resources, contracting store base, and vanishing infrastructures deny families access to the fruits and vegetables that they need that come from their own labor. This too, I would share with you, is a color line. This is one of the reasons why it started with my colleague, the Diversity, Equity, and Inclusion Caucus. We cannot let the president take these honorable and noble words out of our mouth. Yes, I said it, and I say it proudly. How else can we remedy this condition? Drawn not only in wages and housing, but in the very nourishment of the human body. And the cost of these injustices is immense. I seek not to fix the blame, I want to fix the problem. Diversity and equity and inclusion was a step towards remedying the problem. Our nation spends billions, indeed trillions, out of a $4.5 trillion healthcare budget. Too much is spent on the healthcare and not the cure of the problem. Treating diseases that flourish in the soil of poor nutrition. Hospitals overflow, insurers calculate their risk, and we as a people exhaust our resources. People trying to get the necessary help in order to cure the illnesses that could have been prevented in the very beginning. Something as elementary as access to wholesome food. We debate endlessly the mechanisms of health insurance, yet we rarely speak with equal passion about health itself. How is it built? How is it supported? And how is our health system sustained? Insurance, after all, is a shield. But what use is a shield when the arrows never cease? True health requires more than money. It requires justice. It demands that we confront the social and economic forces that condemn entire parts of our population into diets that sap their strength and shorten their days. The question before us I will share with you then is not solely medical. It is economic, it is political, and it is indeed moral. Will we allow corporate profit, governmental neglect, and social indifference to determine the health of millions? Or will we, with clear eyes and a steadfast will, reshape the conditions under which Americans live, eat, and die? We must build grocery stores where none exist. We must create a new economic paradigm that will make groceries profitable because it sustains our life. We must support farmers and local markets that bring fresh food to every table in America. We must teach our children not only the science of nutrition, but the history of injustice that has shaped their communities. And yes, we must declare with unwavering conviction that access to healthy foods is not a privilege reserved for the affluent, but it is a right inherited in every human being. For the measure of a civilization, I would share with you, is not the wealth and not its riches, but the well-being of its poorest. And a nation that feeds its people food that sickens them cannot claim to be great. The future of American democracy rests not only on ballots and laws, but on the strength, vitality, and dignity of its people. Let it not be said that we had the knowledge to heal ourselves and yet chose the path of a slow decline. Let it be said instead that we saw the danger, rose to meet it, and nourished a stronger, healthier, and more equitable nation for all. We can find the cure if we have the will. I thank you.
Powerful, powerful words. Thank you, Representative Jackson. Keep that round of applause going for a moment. Thank you.